Q&A with Rationale for CPC aspirants. Session 27. Hi Saurabh, good evening. So go ahead and we will start our session. I don't want to waste your time. So anyway, we need to learn more today. So go ahead and try to answer this one. So see your guidelines and write the answer so that you can remember. I know you know the answer, but it is better if you have a look on your guidelines once. So today we are going to learn ICD-10 CM Q&A. So along with this, we will learn few tips in order to pass in CPC exam. Yes, Pabo, this is not that much difficult, but you need to have a concrete decision. So I want to become medical coder. You need to know the basics. If you know the basics, you can do anything. So basically, it is like based on you only. So how much you can do the hard work in order to learn medical coding. Initially watch our videos. There are plenty of videos on our channel. So you can watch those and you can learn. So if you have any doubt, please mention in the comment section. So as soon as see, we can provide the feedback to you. But it is not that much difficult, that much easy. Everything depends on you. First of all, you need to concentrate on anatomy and physiology. So if you know those things, you can do medical coding easily. Hi Akash, good evening. So we will discuss our answer at 9:20. So initially Pabo, just watch our videos. Those are free only. So watch as much as possible with you. There is no restriction on that. Good guys, all are doing good. Good job. So as I told you, use your guidelines and try to find the answer. If you are writing the CPC exam, even if you are a live coder also, if you know the guidelines, you can do very easily. Yeah, no worries, Pablo. Sorry, Pabo. Those all are free only. You can watch as much as you can. Yeah. Good evening, Sana. So, guys, here our answer is when a patient has blood test for HIV that is inconclusive. So, what is meant by inconclusive? So, physician did not or blood test did not find anything on the blood test. So, there is no result on that. So, which will become inconclusive. Conclusive means it is completed. So, we got the result. But inconclusive means there is no result. So when a patient has a blood test for HIV that is inconclusive, what ICD-10 CM code is assigned? So if you open your guidelines, page number 20, we have one guideline. Patients with inconclusive HIV serology. So patients with inconclusive HIV serology but no definitive diagnosis or manifestation of the illness may be assigned code R75 inconclusive laboratory evidence of human immunodeficiency virus. So you need to remember that here blood test did not reveal any diagnosis of HIV. So because of that reason it will become inconclusive. So here we need to use R75 based on our guidelines. So that's why I'm telling you guys use your guidelines and write the answer. So those guidelines are useful if you are a live coder also. See, so if you take when do you use Z21? So that also we will learn now. So Z21 is asymptomatic human immunodeficiency virus. So for example, if your documentation is having HIV positive, known HIV, HIV test positive, we need to use Z21. For example, if our documentation contains AIDS or HIV disease or any type of HIV related illness, we need to use B20 and we will check Z11.4. So basically Z11.4 is for screening. So screening for HIV status. So encounters for testing for HIV. If a patient is being seen to determine his or her HIV status, we need to use Z11.4 encounter for screening for human immunodeficiency virus. So we need to use additional code for any associated high risk behavior if applicable. So if applicable, if the patient has any high risk behavior, we need to use that behavior also. So basically Z21 is for only positive, HIV positive without any symptoms. R75 is for inconclusive HIV serology like blood test where physician did not find any HIV. B20 is for if the patient has HIV disease or AIDS mentioned in the document, we need to use B20 and Z11.4 is screening for HIV. So if you remember these four things, you can do easily. So if you in your CPC exam, if you find like these questions, you need to follow your guidelines. So you don't need to remember anything, just follow your guidelines as these guidelines are one by one, step by step in our guidelines. If you don't have guidelines, just you can watch your CPC, sorry, ICD-10 CM book also. There we have these guidelines. So we will go ahead and learn question number 2. So if you have any doubt, after the completion of the session, we will discuss. Initially, we will complete our session, then we will discuss your doubts. So question number 2. HIV negative means we need to use the symptom code. What is the symptom? Yeah, thank you, Saurabh. Anyway, we don't have any guideline related to HIV negative, but HIV, for example, patient has the screening. Okay, so HIV negative means we need to code the symptoms. Hi Pavan, good evening. Thank you Vidya, thanks for your answers. So all are doing good. So in this session, you can use few guidelines and few questions. You need to use your knowledge. Hi Gaurav, good evening. So those both are absent. They may attend lately. So today's Parimila did not come up, and what is her name? Elena is also did not come up. We will wait for them. So anyway, we have plenty of time to learn. So we will wait for them. So second question, we got the answer. So what does MRSA stand for? First one is methicillin resistant staphylococcus aureus, and B methicillin resistant streptococcus aureus, moderate resistant susceptible aureus, mild resistant streptococcus aureus. So our answer here is A methicillin resistant staphylococcus aureus. So as a coder, we all of us know MRSA means methicillin resistant staphylococcus aureus, but we need to know what is resistant and what is susceptible. So basically, resistant means we can't treat staphylococcus aureus with drugs, but susceptible we can treat staphylococcus aureus with drugs. So resistant means we can't treat. Susceptible means we can treat. So try to remember those two words. Resistant, we can't treat with the drugs. If it is susceptible, we can treat with the drugs. So go ahead. Ala wrote correct answer. So next question. What does the fourth character in diabetes mellitus codes indicate? So we have enough time. So write your answer in the chat box. So now, yeah, thank you, Pavan. Thank you guys for participating in this session. But this is very good session. If you are a live coder or if you are writing CPT or sorry CPC, it will become very good session. So thank you guys. We got minimum 5 answers. So B is correct. What does the fourth character in diabetes mellitus indicate? So basically we will use fourth character for any complication associated with diabetes mellitus. So we will check what are the fourth characters. So we have different types of fourth characters. For example, if you take E11.1, we have diabetes mellitus with ketoacidosis without coma is E11.10. E11.11 is to diabetes mellitus with ketoacidosis without coma. So E11.00 is for diabetes mellitus with hyperosmolarity. And as you know, E11.22 is for CKD with diabetes. And E11.21 is for diabetes mellitus with diabetes nephropathy. And if you take E11.3 series, we will use this E11.3 series for diabetes with ophthalmic complications. If you take E11.4 series, we will use E11.4 series for neurological complications with diabetes. If you take E11.5 series, we will use it for diabetes with circulatory complications like, and if you take E11.60, we will use it for diabetes mellitus with diabetic arthropathy like other specified complications. And if you take E11.8, diabetes mellitus with unspecified complications. So our regular code E11.9 means diabetes mellitus without any complications. So you need to remember those few fourth numbers. So if you know those numbers, you can write very easily. Yeah. So most of the people wrote correct answer only. We can try fourth one. Yeah, go ahead and write for this fourth question answer. So basically this is also from our guidelines only. Try to use your guidelines. So these are not that much difficult. Try to use your guidelines so that you can write easily. So now it is 9:35. We will discuss the answer at 9:38. Try to use your guideline. That's enough. Yeah, thank you, Pavan. Thank you, Sarika. So here you no need to do more hard work. Just you need to use the guidelines. Yeah, thank you, Vidya. So we will wait for one more answer, then we will discuss the answer. Thank you, Omkar. Thank you, Akash. Thank you very much. So we will discuss now. So I don't want to waste your time as usual. So when do you code acute respiratory failure as a secondary diagnosis? So first we will learn the guidelines. So acute respiratory failure as secondary diagnosis. Respiratory failure may be listed as a secondary diagnosis if it occurs after admission or if it is present on admission but does not meet the definition of principal diagnosis. So here basically we need to find the whether acute respiratory failure is before before admission or after admission. So based on our guidelines, if acute respiratory failure occurs after admission, we need to code it as a secondary diagnosis. So the reason the patient is admitted will become primary diagnosis or first listed diagnosis, and the acute respiratory failure will become secondary diagnosis. The condition which necessitated the patient's admission into the hospital become primary diagnosis, and acute respiratory failure will become secondary diagnosis if it occurs after admission. So anyway, most of the guys wrote correct answer. Thank you guys. Thanks for your reply. Yeah. So next question, please. Fifth question. Yeah, of course, Pavan. Even guidelines also mention the same thing. So we need to check the documentation properly. So as I told you, these are easy only, but while writing the CPC exam, we need to concentrate more and we need to stick to our guidelines. So if you are familiar with your guidelines or if you are familiar with your ICD-10 CM book, you can get all these ICD-10 CM answers and you will get the full marks in ICD-10 CM. Okay, thank you guys. As most of the people know this one, when the type of diabetes mellitus is not documented in the medical note, what is used as the default type, which is the most basic question of medical coding. So it will lead to type 2, which is A. Yeah, thank you guys. Yeah, go ahead and try for sixth one. When is it appropriate use history of malignancy from category Z85? Thank you, Sonal. So now 940. So guys, if you like our session, please click on like button. So if you click on like button, this session will goes to more people and they will get benefit from our education, our free education. So click on like button in order to motivate me and also help to other coders. If you want to help, just click on like button. Yeah, no worries. Yeah. Sorry, Pavan. So you no need to worry about the answer. Just write whatever you know. Hi, Surinder. Good evening. So we will discuss the answer now. So when is it appropriate to use history of malignancy from category Z85? So here our answer is C. It has been excised, no evidence of any existing primary malignancy, and there is no further treatment directed to the site. So C is the answer here. So most of the people wrote correct. So we need to check the documentation, and mostly whenever we code personal history, we need to check the surgical history. So physician usually mention the surgical history in the document or HMP. We need to check that one, and based on that we can decide. And also we need to check the documentation whether physician has mentioned patient has previous surgery in order to remove the malignancy. So question number 7. So Omkar, it is not when 5 years has passed after surgery, like we don't have any guidelines. So you need to remember that it has been excised, no evidence of any existing primary malignancy, and there is no further treatment directed to the site. And way is also wrong. C is the correct answer. No worries, try to remember now onwards. So whenever you use, in order to use Z85, patient needs to have complete surgery regarding that malignancy, and there is no active treatment towards that. If the physician will provide or patient will take medications prophylactically, it will not comes under active treatment. Thank you, Pavan, Vidya, Akash. Thanks for your replies. So here our answer is B, which is correct. So hi Show Pharmacy. I don't know your name, but the correct answer is J12.0. How do you check? Go to pneumonia and we have first code itself second code itself pneumonia adenoviral. So here it will leads to you Z12.0. It is a direct code, very easy code. So you can call it as basic code. So Shiv Pharmacy, this is not B34.0, it is J12.0. Just go to pneumonia and we can find second option adenoviral. So pneumonia due to adenovirus or viral. You need to code it as J12.0. Yeah. Go ahead and find for this answer. Eighth question. And the people writing CPC exam. So last week we have published one video related to ICD-10 CM tricks while writing the CPC exam, and try to watch that video. That is very useful for you. So if you want, I will post that link here so you can watch whenever you have the free time, but that is very important. Thank you, Pawan. Thanks for your answer. We will wait for a few more answers. Then we can decide what is the correct answer. Sorry guys, here there is a problem. I will make it as A. Sorry. A, B, C, D. Now we can write correctly. Yeah, I will make it as. Yeah, now we can check and write. Don't worry. I will tell you the answer. No need to worry. But try to write. Oh, So thank you guys. So this is the video I am telling. So I kept in the chat box. So you watch that video. That is very important for CPC aspirants. So here our answer is C. So I will tell you why. So a 50-year-old patient has been diagnosed with elevated blood pressure. The patient does not have a history of hypertension. The correct ICD-10 CM code to report is. So if you check your index, you can check elevated, then blood pressure. It is asking us to see hypertension. So if it is elevated blood pressure reading, we need to use R series code. But there is no word reading in the document. So we need to code it as a hypertension. So if you have the book, check elevated, next blood pressure. It is leading us to see hypertension. So that's why here our answer is C. I-10, which is hypertension. Check your book once, you will get good idea. Check your index, elevated, first find elevated, then find blood pressure. It is asking us to see also hypertension. C also means we need to code it as a hypertension. So our answer is the C. So next question. What type of fracture is considered traumatic? Thank you, Chandu. Thank you, Sarika. So whenever you need to answer this, you need to know the definitions of all types of fracture. So if you know those definitions, you can choose the correct answer. So we will wait for few more minutes and we can discuss the answer. So you no need to worry about the answer. Just I will explain. Just but try to write the any answer. Akash, we will discuss that at last. Why means first we need to complete this session. At last we can discuss all those. Why means see here, if you see the guideline, hypertension transient, assign code R03.0 elevated blood pressure reading. So here you need to have the word reading without diagnosis of hypertension unless patient has an established diagnosis of hypertension. So based on our index, if you check elevated blood pressure, it is leading to hypertension. If you check elevated blood pressure reading, it is leading to R03 series. So that's why I told you need to check the documentation, whether reading is mentioned or not in the document. So here now we'll check this question. Ninth question, what type of fracture is considered traumatic fracture? So in order to find answer for this question, we need to find the definitions. So we will check first what is pathologic fracture. So basically pathologic fracture is a fracture which will occur due to any type of pathology like any bone cancers or any osteoporosis, any arthritis, like those degenerative conditions. So because of those degenerative conditions and as well as osteoporosis as well as due to bone cancers, we can consider them as pathologic fractures. So what is spontaneous fracture? So spontaneous fracture basically is a fracture in the normal bone without any apparent trauma. So there is no reason for spontaneous fracture. Bone is normal only, but instantly it will break. So it will become without any trauma. If the patient has fracture, we can consider it as spontaneous fracture. So what is stress fracture? So stress fracture is the fracture which is occurred by repetitive or overuse of the bones or bone structures. It will become stress fracture. So next one is D fracture. Sorry, compound fracture, which is D is the answer. So compound fracture is the fracture which will be occurred due to trauma. So compound fracture is a fracture where bone will fractured into multiple pieces. Usually we will call it as compound fracture. So here ninth question answer is D. So our next question is 10th one. Yeah, go ahead and write 10th code now. So now it is 10-2. We'll discuss the answer at 10-5. Yeah, thank you guys. Here D is the answer. Correct. All are doing good. So here A is answer. A option is incorrect. Why means Z codes are never listed as primary codes. Based on our guidelines, we can use Z codes as primary as well as the secondary codes. If you check our ICD-10 CM guidelines, page number 103, Z codes that may only be principal or first listed diagnosis. So based on these guidelines, we will use Z codes as primary as well as the secondary codes. So here our answer is D. So Shiva, I think this is answer D, not D, yes, not A. So as per the guidelines, we need to use Z codes as primary codes. Few codes we need to consider as primary codes, and based on situation we need to code. So try to answer 11th one. So Gaurav, we don't know about their whereabouts. We don't know about results of Parmela as well as Elena. So we will hope next week they will come and tell us the good news. So now it is 10:06. We will discuss the answer at 10:09. Thank you, Sarika. Thank you, Vidya. So if you are writing CPC exam, try to familiarize with your guidelines as well as the ICD-10 CM book. So I have posted one video in the chat box. Watch that video. You can do very well in ICD-10 CM point of view. Yeah, thank you guys. Yeah, here in which circumstances would an external cause code be reported? So here our answer is causes of injury or health condition. So during these situations, we need to use external cause code. Yeah, go ahead and try for question number 12. Yeah, thank you, Sonal, Shiv, and Vidya, Sarika. So We will discuss the answer. D is the correct answer. So we will learn our guideline once here. So if you check your ICD-10 CM guidelines, page number 80, it is showing us adverse effect when coding an adverse effect of a drug that has been correctly prescribed and properly administered. Assign the appropriate code for the nature of the adverse effect followed by the appropriate code for the adverse effect of the drugs. So basically, adverse effect is the effect which is caused by the properly administered drug. So basically, it is prescribed by the physician and also properly administered by the patient. Then also patient will get adverse effects. So then that condition we can consider as adverse effect. For example, rash developing when taking penicillin is a adverse effect. So penicillin is prescribed by the physician, but because of this penicillin, patient has rash. So we can consider that is a adverse effect. So 19 please. Sorry, 13 question answer. So you need to check the documentation properly whether it is poisoning or adverse effect. Basically poisoning is intentional taking, adverse effect is correctly prescribed medication. So thank you Vidya. Thank you Sarika. Thank you Angel. So your answer B is correct. So what does the root work or root word here, not root work? Kalpo stand for vagina. Good evening Abbas. So here our answer is vagina. So basically physician mostly perform colposcopy. Usually colposcopy is a procedure where an lighted magnifying instrument called colposcopy is used to examine the cervix, vagina and uvula. So B is the correct answer. Yeah, go ahead with and try for question number 14. So basically these are very easy only, but if you are writing CPC exam, you need to do more conscious and write the answer or select the answers. Yeah, thank you guys. So which is answer B, chronic kidney disease. So all are wrote correct answer, no worries. So check this one. Question number 15. Yeah, good Abbas. Your answer B is correct for question number 14. Now try for question number 15. Yeah, it is the correct answer. So based on our guidelines, we need to code highest degree burn first or primary code. So here D is the correct answer. So these are guidelines only. Just if you are familiar with your guidelines, you can answer these things very easily. 16th answer, please. So if you forgot to click on like button, please click on like button now. So if you click on this like button, this video goes to more people. Yeah, thank you, Angel. Thanks for your answer. So which is correct? Chapter 12. What chapter contains codes for disease and disorders of the nails? So it is chapter 12. This is the skin and subcutaneous tissue. For example, if you take in CPT, it will comes under integumentary system. Thank you guys. Thanks for your like button. Nothing else. If you click on like button, So this video goes to more people. So they will also get benefit from this video. So nothing else. Yeah, all are wrote correct answer. Yeah, seventh question answer, please. Yeah, thank you, Vidya and Sarika. Here our answer is A. So seventh character A indicates initial encounter. So A is the correct answer here. So next, try to answer 18. So whenever you have the doubt, try to go to the guidelines and check. Yeah, thank you, Abbas and Angel. Our answer is D, N18.6. So whenever we have CKD's two stages, we need to write the more severe stage like CKD stage 5 and ESRD. ESRD is more complex or severe than CKD stage 5. So we need to code N18.6 CKD as the answer. Thank you, Vidya, Sarika. So question number 19. So Sarika, this session is for you only. Yesterday you have asked ICD-10 CM. So try to remember all these things and don't do any mistakes while writing the CPC exam. First, familiar yourself with guidelines. So everything in the guideline only. As I have told you, watch that video. So I have mentioned few tips and tricks related to CPC exam while using ICD-10 CM. That video is very useful. So try to watch that. We have only two options here, Angel. We have only two options. Sorry, yeah, two options. So check that video. So if you watch that video, if you have, you will get all the ICD-10 CM answers. So basically question number 19 is having only two options. Yeah, thank you guys. We got our answer here. So we will go ahead with other answer. Yeah, here our answer is B. What is the definition of postpartum complication? So basically postpartum means after the delivery. So any complication occurring within the 6-week period after delivery is called postpartum complication. Post means after the delivery. So here any complication occur within the 6-week period after delivery, we will call it as postpartum complications. So try to remember that one. So yeah, question number 20th. Yeah, thank you, Angel. Are you from India or USA? Aksash, Angel, these names are from USA only. So yesterday also we have one Elena from USA. Yeah, no worries, Angel. Just to try to learn whatever you want on our channel. So you will get most of the accurate information on our channel. So and also encourage to watch our channel. Okay, okay, no worries. So here we got our answer. What is not an example of active treatment for pathological fractures? So here cast chin is the answer. Yeah, most of the people wrote correct answer. So that's why we are not discussing more. And also encourage your friends to subscribe to our channel Angel. So this will be very useful for them also. Yeah, this is the last question of the day. We have two options, Sarika, here. So yeah, okay, no worries. You are telling about question number D, sorry, 20. Yeah, that is correct. Yeah, correct. So write about 21. So all of you see 21st question, or do you have any technical problem? Oh, good. Yeah, yes. Our 21st question answer is A, codes from all other chapters. So if you see our guidelines on page number 61, chapter 15 codes have sequencing priority over codes from other chapters. So using this guideline, our answer is 20A for 21st question. So basically Z33 one is for incidental finding. So we need to find the document in order to code Z33 one. So physician needs to mention this pregnancy is incidental to other encounter. So guys, so with this we will complete today's session. So I will wait for 5 more minutes here. So if you have any concerns, please let me know. And we will meet next week. Now it is 10:31. I will wait until 10:34 or 10:35. Thank you, Angel. Thank you, Sarika, Sonal. Try to attend next week's sessions also. Next week we will learn CPT. So if you have any concerns, please mention in the comment section of any one of our video. We will try to make videos on that. Yeah, great, Angel. So if it is possible, watch all videos. Yeah, welcome Surinder, Sonal. Yeah, Sonal, I will try to prepare material for E&M. So if any one of you are having material, please send to Vincent Medical Coder so that we can use those material. So if any one of you would like to share your material, so send it to vincentmedicalcoder@gmail.com so that we can use those material in order to help others. So directly you are going to help other people also or other coders like me. So anyone, any material you can send, no restrictions. Our intention is to help others. So you have 2 more minutes. So if you have any material, send to vincentmedicalcoder@gmail.com and also encourage your friends to subscribe to our channel and learn free medical coding in all specialties, including inpatient, as which is the most complex among all coding specialties. Okay guys, we have 1 more minute left, and try to send the material to vincentmedicalcoder@gmail.com. So Sonal, I will try to post our topic on the WhatsApp group so that you can get to know. Best of luck, Angel. So most of the people are passing from our sessions. Surely you will pass in your CPC exam. So now it is 10:35. I am ending the stream. Thank you guys. Thank you very much. See you next week.